Harm reduction is a set of practices intended to reduce the negative effects of drug and alcohol use. Harm reduction methods are becoming increasingly popular as opioid deaths have skyrocketed across the country. Holistic healthcare advocates tabled today near Tommy Trojan to raise awareness about harm reduction.
So we understand that people are going to engage in risky behavior such as alcohol use, drug use, unprotected sex, and so we want to basically reduce the risk of those risky behaviors by providing alternatives or just safer ways of engaging in those activities. So for example, a big one that we do with people experiencing homelessness is needle exchanges. So I'm wearing a shirt right now that says "We Love Drug Users." It's from Homeless Healthcare of Los Angeles. They have so many locations in LA that basically will, if you bring your dirty needle, they will exchange it for you for a clean one, so that if you're using heroin, if you're using another drug that is intravenous, that you are not spreading HIV or any other type of disease. Other forms of harm reduction are basically condom use. Having a designated driver is like one of the easiest ways of practicing harm reduction.
A Keck professor of preventative medicine says it's important for people to think more openly about harm reduction.
A lot of these harm minimization approaches make sense. You just have to be willing to embrace having an adult conversation about it. And that's something that's hard for us to do in this culture. Look, I have a daughter who's a sophomore at a university, and as a parent, certainly I'd rather have a difficult conversation about substance use rather than a dead child. So, when you put it, when you weigh the decisional balance, it seems like it makes sense.
Giving people the resources to protect themselves and empowering them instead of stigmatizing their substance abuse will help normalize the conversation surrounding harm reduction.